So, JP, if I've got a back problem, do I need a lot of treatment for it?
Yeah, that's an interesting question. We certainly see a lot of people that have received a lot of treatment for their back problem. But often when we see that, we see people that don't quite understand their condition. They haven't been understood or listened to, and they don't have a plan to move forward with their life. So the treatment that people need, and Restore was a great example of that. Across 12 weeks, people received up to 7 sessions of physiotherapy and another session as 6 months as a booster. So that is not a lot of treatment. But that treatment was really personalized. That treatment was directed at understanding the person's problem, to listen to the person deeply, understand their needs, understand their goals, and based on that, examine them with the intention of getting them back to valued activities, and then giving them or co-designing a plan for them to manage that condition and get back to valued living. So that sort of treatment, it requires a lot of partnership and interaction with the patient and the clinician moving towards the person's goals. But it doesn't mean that it requires a lot of treatment. Having said that, people have different journeys. For some people, and again in Restore we saw that, for some people, the change can be really quick. They have a new understanding, they have a new experience of safety in their body, and they have enough self-efficacy and support in their community, in their family, that they can move forward. For other people, the journey is really tough. Even though they're really willing to get better, they want to understand in a different way. It is really hard to shift your mindset when your body is telling you otherwise. So there's a big difference, and people that work with people in pain, there's a big difference in being frightened of something that is external to you versus being frightened of something that is within you. So if your body gives you signs that make you fear it, it is really difficult to change the way you think. And for those people, and the way you behave and the way you embody that experience. So for those people, the change may be much different. And sometimes the person is willing to change, they understand it, but they are not being supported. So that journey can be quite different. And the biggest thing is for the clinician to work as a coach and support the person across their journey. And again, for some people, there will be a need to bring in a different discipline and in co-care with a psychologist, for instance, to help that person to move forward along that journey.